Do you know if you are COVID-free? Get tested and find out. You can help to stop the spread of the coronavirus. Testing is free, and there are plenty of testing appointments available at our convenient COVID-19 testing locations around the island. Book online at www.gov.pm/coronavirus-get-tested or call the COVID-19 hotline at 444-2498 between 9 a.m. and 9 p.m. Everyone in Bermuda can help us stay COVID safe.
Good evening, Bermuda, and thank you for joining us this evening. Tonight, I am joined by the Minister of Health, the Honorable Kim Wilson, who will provide updates on the latest vaccination statistics and information surrounding the recent increase in positive COVID-19 cases and further updates from the Ministry of Health. I'm also grateful to have Dr. Krika Weldon here this evening to discuss the efforts being done by her team at the Molecular Diagnostic Laboratory to map which variants we have seen in Bermuda. Following the Minister and Dr. Weldon, I'll provide you with an update on the COVID regulations agreed today by the Cabinet and other matters. I'm also happy to have the Chief Medical Officer, Dr. Ayo Oyinloye, who can answer any technical or medical questions that members of the media may pose today. First, we will hear from the Minister of Health. Minister?
Thank you. Good afternoon, everyone. The Ministry of Health received 333 test results since the last update, and none were positive for COVID-19. Additionally, since the last update, there were 2 recoveries, and so therefore there are currently 17 active cases again since the last update. Of those 17 cases, 17 are under active public health monitoring, and none are in hospital. Since March 2020, Bermuda has recorded 713 total confirmed cases of COVID-19, and out of those, 684 persons have recovered, and unfortunately 12 persons have succumbed to COVID-19. The mean age of all confirmed positive cases is 43 years, with the median age being 40, and the age ranges from less than 1 year to greater than 100 years. The mean age of all currently active cases is 41 years, with the median age being 47 years, and the age ranges from less than 20, with that age group representing 10 to 19 years, to greater than 50, and that age group representing 50 to 59 years. The mean age of all deceased cases is 75 years, with the median being 77 years, and the ages range from less than 60 years, age groups from 50 to 59 years, to greater than 80, and that age group is from 80 to 100 years. The source of all of our cases is as follows. 210 are imported, 502 are classified as local transmission, of which 410 are local transmission with a known contact or source, and 92 are local transmission with an unknown contact or source, and 1 is under investigation. As investigations proceed, transmission categories may change. Of the over 170,000 test results reported, the mean age of all persons tested is 43 years, with the median age 42, and the ages range from less than 1 year to greater than 100 years. Additionally, during the week from the 21st to the 27th of February, 660 saliva screening tests were conducted. Therefore, as of the 27th of February 2021, results have been received for 6,464 saliva screenings. The mean age of all those persons screened is 56 years, with the median being 57, and the ages range from less than 10 years of age to greater than 100. The 7-day average of our real-time reproduction number is less than 1, and Bermuda's current country status remains at sporadic cases. I will now provide an update on the vaccine program, which plays a critical role in Bermuda's return to normal. We have completed the 7th full week of vaccinations and the 5th week using 2 vaccination centers operating 6 days a week. For the 7-day period from the 11th of January to the 27th of February, Bermuda has administered a total of 20,705 vaccinations. And that figure also rises to 21,387 if you include yesterday's vaccinations as well, which is a remarkable feat for Bermuda. Of the 20,705 vaccinations administered for the period in which we are reporting, which ends again on the 27th of February, here are the following statistics. 11,373, or 55%, were given to women, and 9,332, or 45%, were given to men. Bermuda's goal of herd immunity will be achieved when 70% of our population, and our population according to the last census is 64,054, has been immunized. That is our goal. And to date, 21% of the population has been vaccinated, having received 1 dose, and 11% of the population has been fully immunized, having received 2 doses. Each week since January 11th has seen an increase in the number of vaccinations administered, with 4,314 vaccinations delivered last week. The public has accessed these vaccinations as follows. The Vaccination Center at the Bermuda College, which was, of course, previously held at the Police Recreational Club, has administered 12,036, or 58% of the vaccines. 7,760, or 37%, have been administered at the Bermuda Hospitals Board Vaccination Center. 764, or 4%, were administered at rest homes and long-term care facilities, and 141, or 1%, were administered at other vaccination sites. Assessed against Bermuda's population vaccination priority targets are, in Phase 1A, 1,703 persons, or 55% of those persons aged 80 years and older, have been vaccinated. 441 have had 1 vaccination, and 1,262, or 41% of those, are fully immunized. 381 persons, or 51% of residents in rest homes and long-term care facilities, have also been vaccinated. 70 have had 1 vaccination, and 311, which is 42%, have been fully immunized. 1,365 healthcare workers, or 56%, have been vaccinated. 221 have had 1 vaccination, and 1,144, or 47%, have been fully immunized. 1,393 essential workers, or 59%, have been vaccinated. 405 have had 1 vaccination, and 990, or 42%, are fully immunized. In Phase 1B, 4,523 persons, or 48% of those aged 65 to 79 years, have been vaccinated, with 1,590 having had 1 vaccination, and 2,333, or 31%, have been fully immunized. These are excellent results so far, and I would certainly like to thank all those persons who are getting vaccinated to protect themselves, their families, and our community. Government House has informed us that the government of Bermuda will receive yet another supply of Pfizer vaccines, namely 15,000 doses, later on this month. This is great for our vaccine program, as we are receiving more and more persons who are registering their interest to be vaccinated. I would like to remind residents that we are currently in Phase 2 of Bermuda's COVID-19 vaccine allocation strategy. Phase 2 is for residents who are 50 years or older, have been diagnosed with heart disease, chronic kidney disease, liver disease, or diabetes, have a disability, or are of no fixed abode, or essential travelers, and persons who must travel for medical purposes or to return to school. If you do fit the criteria for Phase 2, please register for an appointment by completing the registration form online at forms.gov.bm/COVID vaccine. Also, we are in the process of making appointments for the remaining persons who are 65 years and older who registered online but have not yet been vaccinated. And we are encouraging all those in that group to continue to register, as they will be prioritized in our booking system, along with all those who medically are vulnerable. If you are not able to access the registration form online, ask a friend or a family member or a neighbor to help you to register online, or you can call the vaccine hotline at 444-2498 and select option number 2. With regard to the numbers of persons who have registered their interest for the week ending February 27, 20,877 persons have registered their interest in getting vaccinated, and the breakdown is as follows. 5,068 were black, 9,704 were white, 2,404 are mixed or other, and 3,701 prefer not to say or did not specify. For those of you who have already registered, thank you, and please encourage your family members and your friends who may be in one of those priority groups that we spoke about to register as well. The COVID-19 vaccination will prevent you from becoming seriously ill or dying from the virus. The more people who are vaccinated, the harder it will be for the virus to spread throughout our community. Please remember that there are those in our community who cannot get vaccinated because of their own health issues, and our immunization will help to protect them. I must also remind people that you cannot get your vaccination if you have traveled and have not yet received your 14-day negative test result, or if you are in quarantine. And you must wear proper face mask and face covering. No neck gaiters, please. And while you are attending the vaccination center, please be mindful of ensuring that you're wearing proper face coverings. As previously announced, there will be changes to the guidance for persons who are immunized. Most immediately, I can inform the public that persons who are immunized are able to travel to Bermuda, and with 2 negative COVID-19 results, that's namely their pre-arrival as well as their arrival at the airport, they may dine indoors, go to work, visit a bar or nightclub, and go to the gym. However, they will still be subjected to our full testing regime, which includes tests on day 4, 8, and 14. If the traveler does not have a pre-arrival test, then the 2 negative test results would be their arrival test and their day 4 test. All immunized persons must practice workplace isolation, and that means if you are a teacher, for example, do not have your lunch in the staff room. Eat somewhere privately. Keep as much separation between you and others as much as possible until you receive your results from your day 14 test. For students in households where the adults are immunized and have been traveling, they will be able to continue to attend school. They will not need to be quarantined at home. For more information regarding these changes, please check the website at gov.bm/coronavirus. With respect to Bermuda's country status, yesterday the Center of Disease Control, or the CDC, reduced Bermuda's level from level 4, which was COVID-19 very high. Travelers should avoid all travel to these destinations, and they now have marked us at level 3, which is COVID-19 high. Travelers should avoid all non-essential travel to these destinations. That was encouraging news, but it is not quite where we want to be. However, even this will be in jeopardy if we cannot control and eliminate the new cases of COVID-19 on our shores. Recently, Bermuda has gone from 9 active cases of COVID-19, where 8 of the 9 were imported cases, to 17 active cases, where 8 are imported and 8 are local transmission, and 1 is under investigation. This happened in just 2 weeks. These new cases represent an emerging outbreak, and they appear to be linked to one of the more transmissible variants, most likely the UK variant. This is very serious news. As investigations into this emerging outbreak continue, the number of cases has also increased, and the risk of transmission that increases with large gatherings of persons presents a clear and present danger. With the increase in locally transmitted cases of COVID-19, we felt it prudent to make some amendments to the regulations, in which the Premier will be speaking about in a few moments. This will help to minimize the time where people may be socializing together in close proximity to each other and in close spaces. And also as we know that increased alcohol consumption can lead to poor judgment calls and slips in protective health measures. The ministry's contact tracing investigations strongly suggest that it is social mixing of gatherings of people that are most likely to produce local transmission and positive cases. Last week, I advised members of the public that individuals who attended house parties over the weekend of February 19th should arrange COVID-19 testing as soon as possible. As I have stated previously, concerning the issue of close contacts, I want to reassure the public that their information will be kept private. It is used only for outbreak investigation. And having said that, I would like to ask persons who are contacted by one of our contact tracers to please be forthcoming with information as it pertains to who your close contacts are. We need this to be able to trace any potential spread, and your cooperation to this regard with our contact tracers could help to save a life. Outbreaks occur when members of the community choose not to follow public health guidelines and measures and are making a deliberate choice. The result is outbreaks of COVID-19, which can have and have had a devastating impact on our economy and our way of life. The wider community does not deserve to be placed under more strict public health measures because of the actions of a few. Every single one of us has a responsibility to adhere to the public health guidelines, as they will help to stop the spread of this disease. They are not difficult. Wear a mask, physically distance, and avoid the 3 C's of closed spaces, crowded places, and close contact settings. Bermuda, we cannot have another spike in positive cases. You will recall that as recently as last November, there were 3 events at 2 venues over one weekend, which resulted in more than 80 persons testing positive and more than 550 persons being placed in quarantine. Many of those persons who were required to isolate and or quarantine were financially disadvantaged due to their inability to go to work. We cannot go back to that. As I've said previously, contact tracing is vital to ensure all persons possibly exposed to the coronavirus are tested and, if necessary, quarantined. I urge the public to cooperate with our contact tracing team. Their work is vital in preventing the spread of this virus. Also, knowing your COVID-19 status is important, even if we are not dealing with an outbreak. Get tested and get tested regularly. I would also like to take this opportunity to remind funeral homes, churches, restaurants, and event planners, anyone hosting services and events, that by law you may be liable to prosecution pursuant to the Public Health COVID-19 Emergency Regulations 2021 as a host of, or as well as being part of or assembled group that exceeds the gathering size permitted by our regulations. And let me remind you, the fine for the first offense is up to $6,000, and the fine for any subsequent offenses is $10,000 or a term of imprisonment for 3 months for any second or subsequent offense. As always, Bermuda, please continue to follow the public health measures and guidelines put in place for our collective safety. Continue to wear your mask and practice physical distancing and get vaccinated when it is your turn. Thank you.
Thank you, Minister Wilson, for your remarks. And I certainly want to say that you and your team at the Ministry of Health have worked extremely hard to increase the pace of vaccinations in Bermuda while continuing to manage this pandemic and now unfortunately dealing with a new outbreak. With the collective efforts of the Ministry of Health, nurses, doctors, the vaccination center staff, and public health staff, and our volunteers, Bermuda has remained among the top countries in the world. 6 now, according to our Wilden data, for vaccinations administered per capita, with 21,387 total doses administered as of yesterday. This includes a continued increase in vaccine doses administered week on week, with 22% more doses administered this week than last week, and that was in addition to the 24% increase which I reported last week. As I have said previously, we are in a marathon and not a sprint. However, these statistics show that our efforts are making a difference in getting more eligible persons vaccinated and that we are consistently moving towards our goal. I want to just say, before I move on, well done to all those persons involved, from the Minister of Health to the Chief Medical Officer and everyone else who is part of this vaccination effort. The volunteers, the people who are getting persons to the vaccination sites, those who are checking up. It is an incredible effort, and we should all be very proud of the work of which we have achieved over the past 7 weeks. Vaccinations are important, but we must also continue to know the threats that face us today, as the coronavirus remains a threat to our well-being as a society. Now we will hear from Dr. Karika Weldon, who will speak to the work that the Bermuda Government Molecular Diagnostic Lab has been undertaking to investigate the coronavirus variants which may be on our shores. Dr. Weldon?
Good evening, Bermuda. I'm pleased to share with you a summary of Bermuda's current testing of the recent coronavirus variants. To recap, the last update I delivered in January, I was able to share initial findings from the first batch of viral genome sequencing results conducted by Public Health England. This included 21 samples from cases between October 27th to November 18th. Initial analysis of the results showed that 8 different strains were identified, with all being imported from the US, the UK, and Asia. None of the strains that came via the UK were the new UK variant that caused the lockdowns in the UK late last year. Both strains identified at that time were both common strains circulating in the UK since March 2020. Oxford nanopore sequencing will be performed on island once all the supplies have arrived. They have been ordered. But in the meantime, we have been able to send 10 samples to CARFA, and we'll be sending a further batch of 50 samples to Public Health England next week. A new rapid variant PCR test, since I last spoke to you, has also been developed, and that allows us to identify variants within 1 hour, as opposed to about a week or so via sequencing. This test looks for signature mutations that are specific to the variants in circulation right now. Once a variant is identified, we will still sequence the sample for the final confirmation. The rapid PCR test Bermuda can detect the following mutations: the 69 and 79 amino acid deletion that is found in the UK variant, or the variant first identified in the UK, the E484K variant, the E484K mutation that is found in the variants first identified in Brazil and South Africa, the N501Y mutation found in all 3 of those variants, the UK, South Africa, and Brazil variant, and also the V1176F mutation specifically found in the variant first identified in Brazil. Our screening assay looks at the deletion, the 484th amino acid, and the 501st amino acid mutations simultaneously. And that allows us to tell if samples are either normal strains, which were circulating prior to the ones of concern, or the ones first identified in the UK, Brazil, or South Africa. As of last Wednesday, MDL commenced rapid PCR variant testing of 365 cases identified in Bermuda from October 6th to the 1st of March, so as of yesterday. We have identified that on island we have had the variant first identified in the UK, as well as the variant first identified in South Africa. But we do not have, at this time, the variant first identified in Brazil. The breakdown of the numbers is as follows. 326 are normal strains, including all linked to the outbreaks in Bermuda experienced at the end of last year. We will still sequence all of these samples to determine which normal strain they were. We have one that is from the Denmark cluster variant, which is not a variant of concern, but it does still have the deletion similar to the UK strain. 35 are the strain first identified in the UK. The first strain that arrived in Bermuda was on the December 13th BA flight. Up until the middle of January, on the January 14th, all UK variant cases were imported from the UK via the BA flights. From the 17th of January until February 20th, the UK variant was also imported via the US, via Miami and New York. There was no evidence of UK variant in any of the local transmission cases until the month of February. There was one South Africa variant imported on the 13th of January via Miami, and there are two that are inconclusive and require more analysis via the viral genome sequencing. From all this new data that we have just received, one thing we can definitely say is that we have successfully managed the UK variant for the last 2.5 months, and should all be proud that when we follow our public health guidance from the Ministry of Health, it is effective regardless of the strain. I am also immensely proud of all the young Bermudians working at MDL who have learned this new skill in record time, less than a week, and have made this data available to us all. I also want to highlight an upcoming biomedical scientist, Kizari Knight, who managed this project extremely well under pressure. Moving forward, MDL will routinely check new cases via this rapid PCR testing and confirm our conclusions through sequencing to understand if any further mutations have occurred on island and to aid in epidemiological investigations. As we soldier on with this fight against COVID-19, let us continue to do our part by following the guidelines that have gotten us all this far. Thank you.
Thank you, Dr. Weldon. And on behalf of the government and the people of Bermuda, I want to thank you and your team who have been in the forefront of our battle against the coronavirus. It has been wonderful to see young Bermudian scientists doing such important work for the country. To hear that that important work has now expanded with our young scientists determining which variants are here on island is inspiring. And I also commend Ms. Kizari Knight and the team at MDL for their incredible work. You have made us proud. There are some who will wish to criticize the work of the MDL. But as a leader of the government, I'm proud of the decision to support this lab. And as Dr. Weldon would recognize, and as all of us know, that we are not 100% perfect, but recognizing that the vast amount of tests that have been done through the lab, 160,000, Dr. Weldon, about to date, a little bit more than 160,000 since this pandemic has begun, in addition to the excellent work of which they are now doing in regards to identifying variants, sets Bermuda apart and gives us more tools in our arsenal. So I want to thank you and congratulate you for your work and your efforts. Both the Ministry of Health and the team at the Bermuda Government Molecular Diagnostic Laboratory have worked extraordinarily hard to ensure that we have the tools to tackle this pandemic. But from the very start, I have always stated that it only takes one person to set us as a country back. One person to cause harm to our economy, one person who can set off a chain of events that will have our students getting set back on their education by not being able to go back to school, one person who can cause a chain of events that can cause an outbreak that can put persons in the hospital or unfortunately lead to more dire consequences, as we have seen recently. Despite our hard work and our progress to date, I am disappointed that we have recently seen a rise in active cases due to what seems to be a single event. This increase is further evidence that COVID-19 is still a threat and can easily spread if persons do not follow the regulations that the government has implemented to manage the impact of the coronavirus in our country. This includes the protocols in place at our borders and the traveler continuum, which requires persons who are not vaccinated to follow specific guidelines until testing negative on day 14. It is imperative that travelers follow these guidelines until the end to protect themselves and others. The government came under immense criticism for requiring travelers to wear wristbands, and the fact that persons have these wristbands and persons who may be hosting events may ignore the fact of a very visible warning that someone can put you and your household at higher risk as they have recently been traveling is concerning. And I would ask all of us to remember that these steps were not put in place because we felt that we wanted to do them. We put them in place because it was the best way to balance having economic freedom, personal freedom, while making sure that we minimize the risk to our country. What is more concerning, as Dr. Wading has indicated, is that the event and the outbreak is a version of the coronavirus that is known to be more transmissible, that of the UK variant. Last week, I advised that the government will not hesitate to reimpose certain regulations if necessary to protect public health and also to protect our economy and also to ensure that our students stay in schools and our schools can remain open. Therefore, today, as recommended by the Ministry of Health, with the support of the COVID Cabinet Committee and the full support of Bermuda's Cabinet, we have agreed to the following. Unfortunately, Bermuda's curfew will be re-implemented from 12 a.m. until 5 a.m. due to the current outbreak of the UK strain. Due to the reimposition of curfew, unfortunately, all businesses will be required to close again at 11 p.m. All of the other existing regulations will remain. Maximum number of persons for group gatherings in a public or private setting will be 25. Outdoor funerals can be attended by up to 50 persons. Indoor funerals can hold up to 25% of the maximum capacity in the venue of which they are held, and table sizes in restaurants, bars, and clubs remain at 10 persons. The boat curfew will remain at 8 p.m., and table and bar service at any liquor license establishment is prohibited. The curfew and business closures by 11 p.m. will come into effect on Thursday, Minister? Thursday, March 4th at, sorry? Yes, oh, sorry. The curfew and changes will come into effect tomorrow. Therefore, this evening is the last night without curfew, and those changes will come into effect with a change to public health regulations that will take effect tomorrow. And therefore, as of Wednesday night, curfew has been set back to midnight, 12 p.m. All measures will be reviewed, and an update will be provided again in 2 weeks' time. The government takes no joy in re-implementing such measures. I take no joy in re-implementing such measures. However, we will continue to do what is necessary to control any outbreaks so that we can contain the coronavirus on our shores. We learned our lesson in November, and we will not make the same decisions as we did then. Now, we have learned, and we will act quickly when there are outbreaks and cases that are under investigation to ensure that we can constrain any outbreaks so that they do not lead to further disruption. As a country, we must not let the freedoms that we enjoy allow us to forget that we have a responsibility to keep ourselves and our fellow Bermudians safe. Though we may go about our individual lives every day, the battle against coronavirus is one that we must continue to face together. One set of careless people can have an impact on the wider segment of this country. It is unfortunate, but this is where we are. And this outbreak is real, and we will take the measures which are necessary to control it. And if there are further measures that are necessary, the government will not hesitate to impose those items. Because number one, we must focus on our vaccination program, and any wider outbreak will take persons away from our vaccination program into outbreak prevention. Number two, we must keep our schools open so our students can learn and not be further set back in their educational pursuits. That is the priority of the government of Bermuda, and we will continue to ensure that we make the decisions that are in that best interest. I know that a lot of Bermudians have asked, especially on social media, what kind of summer and future we can expect to have, the types of activities to be enjoyed, and which events they may be able to attend. The answer to that is determined by our actions today. What we do in the weeks and months leading up to our summer season will influence our circumstances as they come. If we want to enjoy the future and all that Bermuda has to offer, we must ensure that we remain sensible and vigilant in our decision making so that we can eventually put the pandemic behind us. We are getting additional vaccine doses from the United Kingdom. We will be additionally receiving some in the near future, which the Minister of Health will announce at a future point in time through our arrangement with the COVAX facility. We have an aggressive plan and an aggressive target to continue to get these doses in the arms of our residents. But it is vital that we recognize and understand that we are not out of the woods yet. We have seen this movie before, and we are not going back to the place of where we were in November. I owe that to the persons in the Ministry of Health who busted their tails, working many late hours, calling and following up on this outbreak. We will not get to that stage and situation again. And so I urge the persons in this country to remember that these measures are temporary, but these temporary measures will exist as long as are necessary so that we can keep the focus on the vaccination program to touch the most vulnerable and those persons that are most at risk from suffering from this virus and also the disease that is caused by this virus. After tonight, the COVID-19 press conferences will move to every other week. The Minister of Health and I will be back with you on Tuesday, March 16th. Until that time, that we ask that all Bermudans remain mindful of the presence of coronavirus in our community. Ensure that any event that you attend, establishment, or home that you enter is adhering to the proper regulations and not putting anyone at risk. Let's continue to work together to keep each other safe. Before I conclude, I do want to say that I know that the Minister of Health and the Minister of National Security have discussed certain matters. And it is a very delicate balance because I know that people are asking, if we know and we understand things which are happening and things which are taking place, why is action not taken? It's difficult because we have public health, and public health is founded on the foundation of privacy and protection of information. What I want everyone to know and to understand is that any information that is given to an official at the Ministry of Health is not shared with other persons. So if you give contact tracing information, if someone calls you, the Ministry of Health, the CMO aren't going to pass that information on to the Bermuda Police Service. You are not at risk for prosecution or challenges if you are speaking to officials at the Ministry of Health. However, that will not stop the Bermuda Police Service from following up on widely reported matters on social media and other things. That will not stop the Bermuda Police Service from following up with reports which are made to 211 or other places where you have individuals who are not following the public health rules. So I urge that we continue to remain vigilant. The new UK strain is here. It is part of this outbreak. We are working to control it, but it is not only going to require the efforts of the public health team, it is going to require the cooperation of members of the public. This does not mean that you should cancel your restaurant appointments. This does not mean that you should cancel the things that you wanted to do. It just means that we have to be smart in our interactions as we go about our lives until we can meet our vaccination targets as we have set. So as I conclude, I know that many in our community may need extra emotional support, and if you need someone to talk with, please feel free to call the Emotional Wellbeing Hotline. That number is 543-1111, and it is operated on Monday through Saturday from 5 p.m. to 9 p.m. Again, that phone number is 543-1111. As always, to get accurate and timely information from the Government of Bermuda, please feel free to sign up to the Government of Bermuda's WhatsApp service. That number is 504-6045. Add that to your contacts and send a simple message saying hi, and you'll receive WhatsApp updates from the Government of Bermuda. Additionally, you can get government updates by downloading the Tree Frog app. Go to the App Store, Google Play, and in the search bar, type Tree Frog and download the free app today. Before I take questions from the media, I want to remind members of the public that as you go about your daily lives, use the tools that the Government of Bermuda has procured. If you are going out to an event, if you're going out to a restaurant, if you're going anywhere to a gathering, install the We Health app so you can be notified of possible exposures. It is vital, it is important, it is completely private. It can run if your phone only has Wi-Fi, or it can run if your phone has regular mobile data. Download it, use it, and please make sure to do your part to help us keep Bermuda safe. It is unfortunate that we've had to reimpose some of these restrictions. They will be temporary as long as we all cooperate in order to ensure that we contain this outbreak, but that is the priority of the government of Bermuda, and the cabinet is in full support of the Minister of Health as she goes about this very difficult mission of balancing the competing priorities to make sure we get the country vaccinated while controlling this outbreak. With that, I'm happy to take any questions from members of the media, and members of the media may feel welcome to give questions also to the CMO and to Dr. Weldon.
Okay, thank you, Mr. Premier. Thank you, Minister, and thank you, Dr. Weldon. We'll start the question period off with Dawn Burgess from Bermuda Broadcasting. Dawn.
Good evening, all. Up until today, we've had a fourfold increase in cases over the last 2 weeks, from 4 to 19. Would you say we are headed in the wrong direction?
Absolutely. That's why we're getting ready to impose a curfew. And regrettably, those few persons, the actions of a few, are affecting 64,000 people. Had it not been for the irresponsible actions of these individuals and members of the public who are not adhering to the public health guidelines, we would not be sitting where we are with amendments to our regulations imposing a curfew. So no, we are not heading in the direction in which we would like to be. But we're going to take necessary steps, as you've seen the Premier has just announced today, to try to cut it off at its head.
What actions from or lessons from November 28th that we're applying to this outbreak and the way we're handling it?
Well, I think the main thing is we're moving more swiftly insofar as making amendments to the regulations. The events of in November, you'll recall, following the revelations, I immediately moved to impose a closure order on one particular establishment pursuant to Section 88. That was a very critical move on our part with respect to that. The circumstances that we're speaking about now, which has publicly been made available through social media, were private residences as opposed to public locations and locations of resort, so to speak, as the legislation defines.
Okay, thank you. This one's for the CMO. The Pfizer vaccine is showing very positive results overseas in terms of reducing transmission of the virus. Your comments on that?
Yes, it is showing very positive results. But the caveat to that is most of the data that has coming out now is mainly observational studies. They're just looking at what is happening in real life. You don't have a control arm to it. And there are some smaller controlled studies that are giving us the results that we're quite excitedly looking forward to. So yes, it's cautiously optimistic that this is the direction of travel, but the way science works is that you need to aggregate all that evidence to be able to see what the overall effect is, and that's what we're waiting for.
Okay. You may want to comment on this as well, but or the health minister. Pfizer said its vaccine can be stored at higher temperatures, allowing for the possibility of doctors to be able to give the shots to their patients. I know this is requiring FDA approval. Is Bermuda looking at this option?
I had the answer ready for you, but now that I'm in the presence of the CMO, I'm going to yield to him.
Okay. Well, it's you probably will have read the update from Pfizer. You can store it at freezer temperatures for about 2 weeks. That's still, as you say, requires FDA approval. 2 weeks is not exactly long enough for us, and that's the logistics around that planning for something as short as 2 weeks isn't very good for us. So we're confident, as you heard earlier on, the measures we put in place to get this vaccine to people's arms are working. We don't see the need to change that just yet. When we have more doses of vaccines on the island, we might want to rethink our strategy, but at the moment, we're very happy with the direction of travel.
Okay, thank you. I recently was called to get my vaccine and was asked if I could come, when I could come in to get it, and I gave them a time. And then 2 days later, I was sent an email changing the vaccine time to a different date. Shouldn't people be consulted before randomly being assigned a new date?
Normally that is the case. I know that that information was passed on to me and we looked into that. Normally, prior to changing a vaccination appointment, the person is consulted to ensure that it meets with their availability and their schedule. So that was an anomaly in the system.
Okay, thank you. And you may not be able to give me an answer tonight, but if you can send me an email. Government has said that it can get more than 5 doses out of 1 vial of the vaccine. How many doses does Bermuda have left at this point?
That is information we'll have to supply to you. We don't have that right
That's
now.
what I figured.
Okay, that's fine.
Tomorrow's great. All right, thank you very much.
I think of more. Okay.
You can go because you probably say the same thing.
Yeah, of more relevance is the fact that we've vaccinated over 20,000 persons already, and 11% of our population is fully immunized. We have 9,750 doses scheduled to arrive on Thursday, and a further 15,000 doses scheduled to arrive on the 19th of May. That excludes the COVAX facility, which the first 25 to 35% is scheduled to arrive at the end of March. So we have sufficient supplies. We are already in the through the CMO as well as through other facilities looking at procuring more supplies. So we will be in a position to offer vaccinations to every person that's a resident of Bermuda who chooses to avail themselves of that.
Okay. Minister Premier, good evening. Minister, if I could start with you. Still on the subject of vaccines, the Johnson & Johnson vaccine has been approved by the FDA. Do we have any arrangement to get any of that in?
I'm going to use it. If he's here, I'm going to use him.
Right, so the Johnson & Johnson is part of the COVAX facility that we're signed up to. And
Right.
as the minister mentioned, there is also another facility through the CARICOM that we are signed up to as well that would offer us that vaccine. It's still very early days yet, so I can't give you any dates when that will arrive on the island, but that is the mix of what we are looking forward to on the island.
But you're confident that supplies are going to remain steady right through until everybody is vaccinated?
Correct. I think the important thing to stress is that the brand of vaccine you take is not as important as getting the vaccine into your arm. They are broadly similar in efficacy, they are broadly similar in safety. So it's important that as soon as you're offered one, get one. It doesn't really matter what brand you go for.
Because the Johnson & Johnson
people.
is just a one-dose vaccine?
Yeah, but the efficacy is broadly similar to what you expect for Pfizer and what you expect for AstraZeneca. So the sooner you're offered one, just get it.
Okay. Thank you. Now, we've heard about a 10-minute list where people, they've registered for the vaccine, but they don't qualify under phase 1 or 2. They're in their 30s or 40s and don't have health conditions or whatever. But because they've registered, people are getting called up and saying, look, if you get here in the next 10 minutes, they're being called up by the vaccination centre, if you get here in the next 10 minutes, you can get a vaccine. Was that government policy, or is it just something that sort of emerged and evolved, and is it still ongoing, do you know?
We have a standby list, and what that is made up of persons that are in the first 2 phases, and that also, so they may very well have medical vulnerabilities and the like, and that can get to a vaccination center within 10 minutes. And the reason we're saying that is because what we certainly don't want to do is, in our endeavors to vaccinate as many people as possible, we certainly don't want wastage. And the CMO can confirm once you open a vial, you have 6 hours to use it. So if we're at the end of the day and there have been persons that perhaps did not attend for whatever reason, then they will go to that standby list. It's not used as often because right now what we're doing is what we have been doing actually is overbooking 10% in anticipation of persons not showing up. But if they have to rely on it, then they will certainly call persons up and say, because they're on the standby list, can you get up here, so that we're not wasting, because what we don't want to do is waste vaccinations.
Okay. Thank you. Premier, if I could ask, first of all, relating to the restrictions that you've just announced this evening, what is the practical evidence that a curfew between midnight and 5 a.m. is actually effective? The minister mentioned there was one incident where we might now be facing a potential spike because of one incident that took place at a private party. We had a report from the police tonight of another incident of potential breaches of restrictions at a private party. How does the curfew impact that?
Well, I'm going to go from a measure of empirical evidence and just look at our history and look at the fact that with a curfew and a significant outbreak that we managed to keep most of our economy open and we were able to get our active cases down to about 4. And so that is the case. But we don't have to be silly and talk about things, in isolation. The first day without curfew, I believe, was February 18th. Right. There was a party on the night of February 18th that someone attended who was a traveler with a bracelet on, and everyone at the party saw this person with a bracelet. And now we have a full-blown outbreak of a UK variant. That's where we are. And no one likes this stuff. No one likes it. People want to live normal lives. But we have seen the impact of having to bury people. We have seen the impact of the challenges of which we'll have with our public sector workers who don't necessarily want to go and teach in schools where they would be at risk for contracting the coronavirus. We have to make decisions that are for the greater good of the country. I believe that the most important thing is that we can remain open and that we can ensure that our children remain in school. That's the priority of the government of Bermuda. And I know that no one wants us to be on curfew. I don't like it either. But we have to be real. I know that there are so many people who just literally want to go out and drink, who want to stay out and have a good time and all the rest. These measures are in place for us to follow and to minimize risk. Right. Wristbands on people's arms, at parties that aren't, it's just, we are so close to being past this. The United States just announced that they're going to have enough vaccines for every single person in the country who wants one by the end of May. We are now having more vaccines that are going to be supplied. We're not that far. All we're going to ask is for people to follow the regulations that are in place to ensure that I do not have to, the Minister of Health isn't forced to start shutting down vaccination stations because she has to pull nurses and employees from vaccination centers over to outbreak control to try to control an outbreak and do massive contact tracing. The fact is that the less activity that there is to contact trace, the better it is for us. So that's empirical evidence. We've seen it work here. We have seen it work, and that's what we're doing. And the outbreak prevention teams and the CMO can speak better. When we're talking about contact tracing and all the rest, this is for, parties that are happening after hours, late, where people are, that's just a fact. And we just need to govern ourselves accordingly for just a little bit more. Okay. I don't know if you want to add to that.
Well, I entirely agree with what you said. The evidence you had so far is largely businesses are adhering to the rules, and colleagues in the police will tell us that when they do their spot checks, they don't see a lot of violations of the rule. And in our contact tracing, what keeps coming up is private social events. So that needs to stop, really.
And I'm just going to say, I know that people are going to say, well, private events and social events can happen today. Yeah, they can, but I'm not trying to put the country on lockdown. So we have risks of which we have to mitigate, and we're going to mitigate those risks. And here's the thing. I will take the barbs and criticisms as they come, but I'm going to support the Minister of Health, I'm going to support the CMO, and I'm going to support Dr. Weldon any day, because I know the stress of which they were under in November and December. I know the stress of which parents were under when they had their children at home. We're not going back there, and we are going to be very aggressive. We're not going to make the same mistake last time. I said that we believed their own hype. We fell into the testing. We thought there was enough testing. The testing cannot catch up if we have an outbreak, especially as we have right now, of a highly transmissible strain, which some evidence has been shown that could possibly even be more serious to a person's health.
Okay, thank you. Talking about keeping Bermuda open, lots of cafes and restaurants saying that they're suffering because they're not getting business during the day because so many people are still working from home. They're not coming into the offices, they're not going out for lunch and getting their coffees and all the rest of it. What's government's policy in terms of, or government's advice in terms of, do you think companies should be encouraging staff to come back to their offices, or would you still are you still more comfortable with, it's a case of if you can work from home, then do so, and, you know?
I'll let the Minister of Health speak to that first, and then I will follow up.
In the first instance, what we have promoted, I think we announced it maybe a couple of weeks ago when we did the last regulations amendments, is that we are still encouraging remote working. That is still being encouraged. However, if persons are allowed to return to work and they have the proper ventilation and physical distancing is maintained, sanitation, et cetera, then by all means they can go ahead and continue working within their workspace.
Okay.
And what I'm going to say in addition to that is that we, as you would have heard in my comments, I'm not asking people to, cancel their restaurant appointments. I'm not asking people to do those things. We certainly have to support our local economy. I know that many offices have reopened and people are going back to work. And as we get more and more further down the vaccination program, as we take care of the ones that are most at risk, are 65 and older, and as we get more vaccines that are on island, that we can make sure that we broaden and move possibly to a future stage to additional phases of that. I know that there will be additional offices that will be reopening their offices even further. But it is a delicate balance. We know, the CMO knew that, of course, we did have some outbreaks at offices that took place in October and November. So November and December. So I'm pleased that many businesses are doing their part in holding firm, but I also want to ensure that we are all, as a country, doing our jobs to support our local business. I mean, we've seen retail sales for the last, I want to say, 6 or 7 months that have all been trending upwards. And that's good news. That means that people are supporting our local economy, but I recognize the challenges that are there. But it's a very, very difficult balancing act, and the government has to act in the way to reduce risk in this instance. So for employers that want to welcome their staff back to their offices, as long as they follow the public health guidance, they are welcome to do so. We did change our guidance, as the minister has said, that if you can work remotely, you are free to do so, but we are not mandating or pushing or recommending remote work.
Right. And one final question, Premier. Bars and restaurants have obviously had to curtail their hours recently and will have to do so again from tomorrow. Are they going to get a break on their liquor license?
The answer to that question is yes, and that will be announced at a certain point in the future.
Thank you.
I am mindful, and this government has been mindful of the pains and challenges that have been put on businesses. So just like we did with taxi licenses and just like we did with other things, the support of which we've offered has been generous to many businesses, and we're going to continue to offer that generous support. It is what is necessary for us to do. So the short answer to the question is yes.
Thank you, Premier. Minister.
Ready to close?
Premier, we actually do have a question that came in from TNN, if I may. TNN understands several countries like India and Slovakia have used or are starting to use a very inexpensive drug, ivermectin, to try to reduce the chance of catching COVID or helping people recover from it without getting sick. Has the government looked into acquiring this drug for use to reduce the spread of COVID in Bermuda?
I think that's for me.
Thank you, CMO.
Yes, ivermectin is an antiparasitic drug used to combat river blindness, and is also used in pets to combat parasites in pests. It's very cheap, that's true. There's been some small studies that shown efficacy in some people who've been infected with COVID-19. However, these studies are quite small, and you cannot really base policy on those kinds of small trials. There is a big trial going on called the Discovery Trial in the UK, looking specifically at that question, and that will give us the sort of information that we need to be able to make a policy decision around this. So until we get that, it's at the moment the science does not support it.
Thank you, CMO. I do have another question from TNN, and I'll read it out on behalf of Trevor from TNN. And it has to do with vaccination cards. The allegation is that vaccination cards are being fraudulently copied and sold in the U.S. What precautions have been put in place to determine the authenticity of a vaccine passport presented?
I'll let the Premier speak about the status of the vaccine passport, which was discussed last Tuesday's press conference. However, in the interim, we do have the vaccine card that's being administered, the vaccine card that we're giving to persons if they need something that's, I guess, confirmation of travel, confirmation for their travel, etc. It'll have the seal, the embossed seal from the Ministry of Health on it. But we are working on a more technologically based solution that I will yield to the Premier on.
Thank you very much, Minister of Health. As reported in last week's press conference, the work from the government is continuing on that. There was a briefing that I gave to the Cabinet Committee as Minister responsible for information technology in the government review. It's a project that we are working on with a number of partners, and we look forward to having more items to announce on that at our next press conference. However, as I reported to the Cabinet Committee on COVID, it is unrealistic that we will have any form of vaccine passports that are electronically implemented before May.
I have one final question from TNN, Trevor at TNN. This is for Dr. Karika Weldon. As a reminder, Dr. Weldon, how long does immunity last after getting the 2 jabs of the vaccine?
You leave that alone? You want to give it to the CMO? CMO, that's for you.
Chief Medical Officer, thank you.
All right, so it's those how long is a piece of string questions. Let me just remind you, the very first people to get the jabs from this vaccine that we're using were the first participants in the trial who got their vaccines around July. And the manufacturer has been monitoring them since then. So the antibodies and evidence of immunity still persists in those people. We know for certain that the immunity you get from the vaccine is better than what you get from natural infection. It's stronger, more persistent. There have been several small studies looking at the immunity from natural infections, and it varies from 3 months to about just about 12 weeks to about 5 months, depending on the study that you're looking at. So that's from natural infection, and what we know from the way these vaccines works is that it gives stronger, longer-lasting immunity than natural infection. So we expect that it will be longer than that, but exactly how long it's going to be, nobody knows.
Thank you, Doctor. Thank you, CMO.
Thank you. Before I close, just a couple of things I got a note. For the first instance, there was an incorrect slide that was put up that had misrepresented the number of coronavirus deaths that have taken place in Bermuda. That slide is being corrected, and we apologize for the error. The number still remains at 12. Finally, before I close, there's a number of persons who have asked why are we not, I guess I would say, making an example or finding or clamping down on the individuals and persons who may have been responsible for hosting events which have led to this outbreak. I took time to try to explain of the fact of the separation between the enforcement arms of the government of Bermuda, which is the Bermuda Police Service, and the Ministry of Health. The Ministry of Health does not engage in those activities for information of which they get from contact tracers and others, as health and public health is important to have privacy. If we go down that road, then people will stop giving us information, and then we'll be in a worse place. I know it is a difficult thing to manage and to understand. What I have been informed by the Minister of National Security is, and I will read the message from the Minister of National Security, is that the Bermuda Police Service are actively investigating a house party in the Smiths Parish, and a file is expected to be submitted to the DPP in due course. So on the matter of the particular instance of which we have been speaking about, the Bermuda Police Service have stated publicly that they have opened up are investigating and expect to submit a file to the Director of Public Prosecutions in due course.